One of the number one questions that we are asked and or patient issues that we deal with specifically during pregnancy is hydration. We always tell patients to increase their fluid intake during pregnancy because it makes such a huge difference during the pregnancy, but some people don't understand exactly how much we mean. During a normal pregnancy, it takes approximately 4 extra liters of fluid for just the pregnancy, just the baby. So think of a 2-liter bottle of soda, and it takes 2 of those just for the baby. So if you're not taking in, when we ask a patient how much water they're drinking in a day, and they say, oh, I'm drinking a lot, I'm drinking 6 bottles. 6 16-ounce bottles is not even close to managing 4 liters of fluid. And again, that's just for the baby. That's not what the mom's body is drinking and what the mom's body is using too. Decrease in fluid intake and not having enough fluid intake increases issues with, number one issue is headaches. That's one of the number one signs of dehydration. It can get down to where your uterus can start contracting because the uterus is a muscle. And my analogy I always use is it's a muscle just like a chicken breast. And if you take a chicken breast out of the fridge and throw it on the counter and you don't put moisture to it, what's it going to do? It's going to dry up and it's going to contract. The uterus is the same thing. If you do not put moisture to it and keep the elasticity going to it, keep that moisture to it, it's going to contract. It's going to dry up. Yes, it can go to the point of preterm contractions, preterm labor, and yes, it can go into full-blown labor. So it is one of those things that we really push fluid intake, and to make people understand how much fluid we're needing you to take in is not an extra bottle of water a day. We legit need a lot more than that. I mean, a gallon a day is a good start. So, if the patients can keep that in mind to increase their fluid intake, it really does make a big difference.